No patient is harmed by infection in this facility. That is our guiding principle as we provide increasingly more complex and complicated patient care. Promoting and maintaining a safe environment of care requires that everyone understand how the healthcare environment has been impacted by environmentally hardy, multi-drug resistant organisms such as MRSA, VRE, C. diff, Acinetobacter, and others. In addition, respiratory illnesses such as influenza and gastrointestinal illnesses such as norovirus can also contaminate environments and result in transmission among patients and healthcare workers. A clean environment is important to us all. During the course of the next few minutes, we will provide educational tools for you to use in helping ensure healthcare workers understand the impact of the environment and its potential impact on patient safety. We will also provide introductory guidance on a method you might use to demonstrate performance evaluation when training those responsible for environmental cleanliness. Remember, however, that maintaining a clean environment requires that everyone understand their part in the process. We are all accountable for patient outcomes. Therefore, we are all responsible for doing what needs to be done to make sure our environment of care is properly cleaned. When the patient environment is cleaned, the goal is to clean equipment and surfaces in the room, as well as kill microorganisms that may cause illness. Always use a hospital-grade, EPA-registered germicide to clean surfaces and equipment. Focus special attention on high-touch surfaces such as counters, handles, switches, cables, bed rails, monitor screens and touch pads, and other items frequently touched by patients or healthcare workers. Just because the room looks clean does not mean it was adequately disinfected.
The spread of infections within hospitals is a reality that infection control practitioners are dealing with on a daily basis. Many things play a role in the spread of infections. The patients come into the hospital with infections, and in some cases they can be spread. A number of things play a role: hand hygiene, the environment. Today we're going to look at a simple and easy technique to evaluate the spread of infections within the hospital. We're going to use a fluorescent powder and a black light. What we'll do is we apply the fluorescent powder to several high-touch areas in a room, usually about 10. The patient will come into the room, they'll stay as long as they need to, and then we'll come in with a black light on a daily basis, and then after the patient is either moved from the room or discharged, and we'll see what areas still have the fluorescent powder.
Using fluorescent powder, you can see the environmental contamination that may actually be present in this room. Places touched by healthcare workers, as well as items touched by patients, are contaminated with a variety of microorganisms. Without disinfection, these organisms may live on surfaces for hours or even days. Once contaminated, as shown here when a healthcare worker touches a patient bed rail, organisms remain on the item and can be transferred to the hands of another healthcare worker. From there, those organisms can be transmitted to other surfaces and other patient care areas. This is why hand hygiene is of vital importance. When cleaning a patient room, make sure that your procedures include the cleaning of items commonly touched by healthcare workers. Make sure equipment, such as infusion pumps, are sent for reprocessing immediately when the item is no longer needed for the individual patient. Make sure items that remain in the room, such as monitors, cables, IV poles, glove boxes, and dispensers, are all disinfected. Every healthcare worker understands that it is important to evaluate the effectiveness of our work. Evaluating activities designed to clean the environment is an important example. One easy way of evaluating how well a room is cleaned is to apply small amounts of a fluorescent powder on items you would expect to be cleaned.
Okay, when using the fluorescent powder in the environment, it's important to target high-touch areas, including on the hospital beds, the handles, the releases, along the walls, soap dispensers, glove boxes, door handles, light switches, and around the sink, the faucet areas or the countertops. And the reason why we target these high-touch areas is people are always touching these and they're more likely to be contaminated with bacteria.
To evaluate the high-touch areas that have been stained with fluorescent powder under black light, one of the things we have to keep in mind is that the powder is an inert substance and it requires a bit of effort to wipe away. And so one of the things we recommend is to use a 3-level rating system when evaluating the high-touch areas. We use something like a 2 for places which have not been touched at all, 1 for places where the the fluorescent powder has been smudged, and 0 for places where the fluorescent powder has been completely removed.
No patient will be harmed by infection in this facility. We take those words to heart. Maintaining a clean environment and cleansing our hands are essential elements of a patient safety program. We hope you are able to use these visual components in your training and evaluation programs. Together, we can prevent transmission of infection and ensure that our patients, as well as ourselves, are safe.